Hand hygiene and aseptic technique serves as the foundation for infection prevention and control in clinical settings. This presentation focuses on the rigorous standards required to ensure patient safety and healthcare worker protection. We will explore the specific protocols, evidence-based techniques, and compliance strategies that define modern aseptic practice. Understanding these core principles is essential for reducing healthcare-associated infections and maintaining a sterile environment during medical procedures. Throughout this lesson, we will examine the nuances of hand hygiene that go beyond simple washing, incorporating global standards and specialized surgical requirements. Proper execution of these techniques is a professional responsibility for every member of the healthcare team. Hand hygiene protocols and techniques is the fourth lesson in our series, focusing on the practical application of sanitization standards. This section bridges the gap between theoretical microbiology and clinical practice by detailing the exact methods used in hospitals today. We will delve into the specific guidelines provided by the World Health Organization and the CDC to ensure a standardized approach to care. By mastering these protocols, healthcare providers can effectively break the chain of infection. This lesson emphasizes that hand hygiene is not just a habit, but a precise clinical procedure that requires attention to detail, timing, and specific mechanical movements to be truly effective. The WHO 5 Moments for Hand Hygiene defines the standard for clinical interactions. Moment 1, before touching a patient, is designed to prevent the colonization of the patient with hospital flora carried on the hands of the provider. Moment 2, before clean aseptic procedure, is a critical moment to prevent infection and must be performed immediately before the procedure, even if you are planning to wear gloves. Moment 3, after body fluid exposure risk, is essential because it protects the healthcare worker and the surrounding environment from potential pathogens. Finally, Moment 5, after touching patient surroundings, involves cleaning hands after touching bed rails, tables, or monitors, which is often the most missed moment in clinical practice. CDC guidelines for healthcare settings provide specific rules for daily practice. ABHR preference means alcohol-based hand rub is recommended for all routine hygiene, unless hands are visibly soiled. Soap and water usage is mandated for situations involving visible blood or dirt after using the bathroom, and specifically for spore-forming pathogens like C. diff. Regarding fingernails, natural nails must be kept less than 1/4 of an inch long, and no artificial nails or extenders are allowed, as they are linked to fungal and bacterial outbreaks. Jewelry recommendations suggest minimizing items because rings inhibit effective scrubbing can harbor bacteria. For skincare, only hospital-provided lotions should be used to prevent dermatitis, as outside lotions may degrade glove integrity or interfere with antimicrobial soaps. Technique: hand rubbing using alcohol-based products requires specific steps for efficacy. Regarding volume, you must use enough product to cover all surfaces of the hands, which usually requires 2 to 3 pumps. The duration is also key. You must rub your hands until they are completely dry, which should take approximately 20 to 30 seconds. The steps include a specific sequence: palm to palm, interlacing fingers, cleaning the back of hands, knuckles, thumbs, and finally fingertips. A critical error to avoid is waving hands to dry them or wiping them on your scrubs, as this recontaminates the hands immediately. In terms of efficacy, hand rubbing is actually more effective than washing for reducing overall bacterial counts on the skin. Technique: hand washing with soap and water is necessary for physical decontamination. You must wet hands first to prevent the soap from irritating dry skin. Then, apply soap in a sufficient amount to generate a rich lather across all surfaces. Friction is the most important part. You must scrub vigorously for at least 15 to 20 seconds to mechanically remove microbes. Specific areas of focus should include the thumbs, fingertips, and finger webs, as these are most frequently missed. For rinsing, ensure you rinse thoroughly under running water with hands pointing down. Finally, for drying, pat dry with a disposable towel and use that same towel to turn off the faucet, because the faucet handle is considered dirty. Surgical hand antisepsis is a more intensive process than routine washing. The pre-wash phase involves washing with plain soap and water to remove visible debris and using a nail pick to clean under the nails. Methods for the main antisepsis include using antimicrobial soap with a scrub brush or sponge, or using an alcohol-based surgical rub. The duration should be between 2 to 6 minutes, following manufacturer instructions. Notably, long scrubs of 10 minutes cause dermatitis without providing extra antimicrobial benefit. The direction of the scrub is vital.
Always work from clean fingertips down to the dirty elbows. During rinsing, hands must stay above the elbows. For drying, use a sterile towel and a separate quadrant of that towel for each hand and arm.
Glove use and hygiene is a supplement to, not a replacement for, hand hygiene. Before donning gloves, hands must be clean and completely dry, because moisture trapped inside breeds bacteria. During use, it is vital that you do not touch environmental surfaces, like phones or door handles, with contaminated gloves. Double gloving is the standard for surgery because it significantly reduces the risk of exposure if the outer glove punctures, which happens at a high rate during operations. After doffing, hand hygiene is mandatory because hands often get contaminated during removal, and bacteria multiply quickly in the warm, moist glove environment. Finally, regarding sanitizing gloves, never use alcohol-based hand rub on them, as it degrades the glove material. Compliance monitoring is necessary to ensure these safety standards are met. Direct observation involves auditors recording actual actions versus opportunities based on the 5 moments. This can be influenced by the Hawthorne effect, where staff behavior improves simply because they know they are being watched. Electronic monitoring uses smart badges and dispensers to track usage frequency, providing high data volume though it lacks clinical context. Product usage is another metric, measuring the liters of alcohol rub used per 1,000 patient days. Ultimately, feedback is the most important element. Data must be reported back to the specific units to drive a culture change and improve overall adherence to the protocols. Common barriers to adherence must be addressed to improve safety. Skin irritation is the #1 complaint from staff, which is addressed by using high-quality emollients via alcohol rubs. Accessibility is another factor. Dispensers must be located at the point of care, such as the bedside, rather than just at a distant sink. Workload is a frequent excuse, with staff feeling too busy. However, alcohol rub takes only 20 seconds compared to 60 seconds for washing, making it the only feasible option for high-intensity care. The knowledge gap refers to a lack of understanding of the 5 moments, such as missing the requirement to clean hands after touching the environment. Finally, role modeling is critical, as medical students mimic the behavior of residents and leadership. Thank you for completing this lesson on hand hygiene and aseptic technique. We have covered the essential moments for hygiene, the specific techniques for both hand rubbing and washing, and the specialized requirements for surgical environments. We also examined the importance of proper glove use and the various ways hospitals monitor compliance to ensure patient safety. By addressing common barriers like skin irritation and accessibility, healthcare facilities can improve adherence and reduce infection rates. Remember that consistent application of these practices is the most effective way to protect both yourself and your patients. Your commitment to these protocols is a vital part of providing high-quality, safe healthcare.